The old age of the United States healthcare system, often described by those who use it most as fragmented, disengaged, wasteful, confusing, unsustainable, and costly, has caught the attention of visionary leaders across the nation that include our governments, our hospitals, our payers, our employers, our physicians, and our patients. They are all working together to usher in the new age of healthcare, giving birth to concepts of accountability, population health management, clinical integration, patient engagement, affordability. Baylor's Scott and White Quality Alliance is leading the charge for healthcare transformation, implementing 3 key strategies deemed essential to care management and ultimately clinical integration: patient-centered medical home, care coordination, and data analytics.
We are trying to pull together providers of all types: physicians, nurses, hospices, skilled nursing facilities, hospital facilities, to come together and coordinate care so that we can take out inefficiencies and lower costs, at the same time improving quality.
It is being a part of a connected care delivery system, really from the primary care physician all the way to the skilled nursing facility and everything in between. Transforming medicine to be protocol-driven.
Care has not been well coordinated, and while comprehensive care existed in pockets, it was not applied as a population overall. What we're trying to do inside of the accountable care is facilitate a lot of the information exchange. Getting the right thing at the right time in the right way approach is what we're doing inside of accountable care.
The first stop for population health management is primary care anchored in a patient-centered medical home.
Good afternoon. Hi.
Where the patient is matched with a primary care physician who acts as the quarterback for care, treating the patient but also directing care teams to ensure a comprehensive, high-quality patient experience.
We're going to do the back first, if I don't make you hyperventilate. Here we go. Take a deep breath.
Mary is a 71-year-old patient with multiple chronic conditions. Her experience is an example of the complete and coordinated care Baylor Scott and White Quality Alliance delivers to patients.
When someone develops a chronic medical condition and requires the use of numerous specialists, numerous resources to manage their disease, so many things fall through the cracks if there's no coordination. And one of the beauties of being in an advanced quality alliance is that we can coordinate this care. How are you doing on refills? Are you doing really well with most of your medicine?
This coordinated care is very helpful to your whole well-being. You have your nurse, your doctor, your hospital people, all under the same knowledge about you. It's just an extra amount of somebody caring.
Primary care, we think, is kind of a foundation for a lot of the work that we want to do. It is a place where care can be coordinated more easily. And like most complicated systems, you need something to kind of manage that, to set some standards. We've used the patient-centered medical home, which gave us a standard that we could say to all of our practices, this is what you need to be doing. It means using an electronic health record appropriately.
Coordinating care and addressing the needs of complex patients, some of whom have 5 or more chronic conditions, is vital to achieving clinical integration.
Care coordination is just what it says. We're coordinating the patient's plan of care. The physician makes the plan of care. We help explain it, help support the patient in successfully executing it.
Well, let's talk about how high is your blood sugar this morning.
And then bring anything to the provider's attention that they may not have discovered in their assessment of the patient.
So how are you feeling since you've been discharged?
The best thing for people is for them and their family members to take care of themselves and each other. And a lot of people are very well intentioned, they just don't know how. So we provide them with the tools and support that they need to get it done.
Okay, well, let me get back in touch with your primary care physician. I think looking at your medications.
Baylor Scott and White Quality Alliance's Comprehensive Care Management Department also assists patients transitioning from hospital to home.
We make them an appointment within 7 days of discharge, and then we continue to follow them for 30 days. The goal being to keep them in the home, because most readmissions happen within 30 days of discharge. So we try to prevent those readmissions. In one of our MA plans, we saw readmissions decrease last year from 16% to 11% just by doing this process properly.
Bless her heart, she just got home from the hospital. She was in the hospital for a month and she has a new trach.
We start with a delineation of the population called risk or predictive modeling. 5% of the sickest of the sick, if you will, tend to drive about 50% of the cost. The next 15% are rising risk will be part of that 5% if something's not done. And the 80% either have not accessed the system yet or are very healthy, and we want to continue to manage them as well. So this is the blood pressure look. So this was we're trying to manage the entire population to try to improve their wellness.
Analytics is very much a key part of the ACO and the inner workings of the ACO. And we have to have people who understand predictive modeling and understand how to stratify a population and make sure that we are focusing on the 5% and the 15%. So we're really trying to be laser focused on the populations that need additional support.
Hi, Ms. Tass. It's Joanne, the RN Healthcare Manager, calling to see how you're doing with your congestive heart failure.
For the highest risk patients, we staff RNs, and we supplement the RNs with social work. For what we call a rising risk patient, or the next 15%, we staff medical assistants.
Do you understand all of your hospital discharge instructions?
They're in the bottom 80% and don't seem to have risk, but need a wellness exam. Sometimes those can be done either just by telephone calls from the office or even a virtual outreach through something we call Telebox. It just calls them to remind them of a wellness visit.
Baylor Scott and White Quality Alliance is transforming healthcare for the better. Over its first 2 years in operation, Baylor Scott and White Quality Alliance reduced admission rates by 9%, readmission rates decreased 10%, and Baylor Scott and White North Texas Employee Medical Plan costs were reduced by 6%, equating to approximately $24 million in savings.
We finished 2 complete years of patient care. In those 2 years, the population that we've had the most opportunity to manage have had only about a 1.5% increase in cost of health care. During those same 2 years here in Dallas, we have had about a 10% increase in the cost of health care. At the same time, we've met every one of our quality measures that are in our contracts. This has been done with just putting systems in place.
Things that we have improved on are things like generic prescribing. So we've lowered the cost of pharmaceuticals, reducing when a patient goes into the hospital and maybe bounces back, instead helping them bounce to their primary care physician.
If we come together, we agreed to coordinate, we agreed to clinically integrate and try to solve these problems together. I don't think there's anybody better to solve those than the people that are actually providing the care and deliver on this dream of what we think healthcare can be.